Can you fix it? Yeah. Okay, what is the problem? How old are you? How old are you? Translation. 63?
65.
65? Okay, can you see the problem now? What's the problem? You should know the problem right away. By the looking at one, just 2 seconds. Meridian line, yeah, of course. She also have a similar problem under the eye. Can you see? Can you see the filler? Previous filler? Can you see here? Here, the bulging out, which is not the eye bag area, but bulging out this area. Here, can you see? This is the filler. Also superficial. Can you see the bluish color? A little bit bluish. I told you, so many patients like this. I see so many patients in Hong Kong, Korea, all other countries. Because today you listen to my lecture, from now on you look at the patient, you will find it. But before you didn't notice it. Actually, I can see more fillers on her face. Which area? Can you point out? Can you point out? She has a bulk of fillers here. This area. Okay? So actually she has a sagging all this line together. You know, when you put the filler, especially with many doctors, actually many company, they train you to put a lot of fillers. Why? They want to use a lot of fillers. I went to Thailand and they put 10 cc on the full face fillers. I never put that much of filler, okay? I only put 1 cc or 2 cc. That's the minimum, maximum. I don't put too much, but you can see the bulk here. You can see the bulk here. So this is the previous filler. So that's why this line all destroyed, you know, coming down, sagging down all together. Okay, this line coming down all together. How many years ago did you put the filler here?
幾多年前打嗰個針啊？大概幾多個咗？應該
最上一次咪都係條醫生幫我做。
哦，唔係打嗰啲填充啊。
3年前。
3 years ago.
3 years ago. You see, I told you most of the filler after 1 year, 2 years they should go away. But why 3 years but still there with the bulk? So you will find uncountable patients in this, your practice. So if you solve these problems, again, you become the guts to the patient. And we have to make her face lighter. Actually, she's also a difficult case, and I want to solve this one with our RF cannula. But we have no time, so we will just do the cannula thread, okay? So we do the design.
做面咯，同上次應該差唔多，同上次差唔多，都係做提升塊面。
Okay, so this is our basic line. Remember this one? And tragus 1, 2, 3. So this is the entry point, 1 centimeter below, 1 centimeter below, and the middle, 1 cm below, 1 cm upper. So this will be the very base line. Also, you see when you do this one, can you see the filler here? A lot of filler here. Can you see this bulk? Yeah. So this is how to test where are the fillers in the nasolabial fold. But actually, they already migrated here. A lot of fillers here, So I see also uncountable migrated fillers. So 1 here, 1 cm below, 1 cm below, follow the nasolabial fold. And here, from the lateral contours to the upper border of the ear, you draw a line, and in the middle, so this will be your entry point, and 2 and 3. 1 centimeter down, 1 centimeter down, okay? So usually the line is, in one line. So this will be, if you remember some patient with a malar protrusion, we don't go this way. But the first one, go to the last one. Okay, we go last one, and then second one go to the first, something like this. She is okay. She's not too much protruded. So, but most of the Asian, Korean, Hong Kong, you have to be careful. The malar protrusion, you will have a, because you see, the thread should go something like this, but because of protrusion, it's very difficult. So you go the first one, go below the protrusion, go to the last one here. Okay, then usually you can do it safely. Okay, so we do the superficial injection. You prepare the cannula quickly. Okay, we use the the A-type cannula, super emboss, and I just show one in the middle for the double molding. Give me the thread. Okay, 18G. 放長啲，放長啲。
瞓上啲，瞓上少
瞓
少，
上少少。
more。
再多啲，再多啲，
more。
再多啲，再
Okay. Okay, give me the cotton. So clean up the entry point. So make a 18G, make a puncture. I told you make a one clean puncture, okay? Something like this, okay? Don't do this way. Just make a one clean puncture. Okay. Please come up more.
要再瞓上高少少，
瞓成個人褪高啲，再高啲。
Yeah. Okay, it's better. Okay. So you hold it. You hold. Yeah. Left hand. Not too much. Did you put also filler here? Because you see after I pull, there is also protrusion here. She also put filler here. Can you ask?
你呢度有冇打過木偶紋？有冇打過針啊？
打個咩啊？
打過針，打過填充物。
呢個木偶嗰度打過。
打過。
Long time ago.
Long
幾
time.
耐之前？
You see?
幾耐啊？有一
I told you this kind of filler because of this protrusion. So when you put the thread, because of that one, your thread will tend to go up and make protrusions and irregularity and dimpling. So you have to be extra careful with those previous filler. Okay, give me the.
幾級嘅？
Bye. Thank you. Okay, this is a super emboss with a. So you make it straight. Actually, even I make straight, there is a protrusion here because of the filler. So just be careful. And this thread is quite thick, 2 point. So you see the A type. It's very smooth, very easy to go in. Finish. You have to try, okay? And you take off this cap and just push this one. And while you are pushing it, just take out slowly. Because the thread is too thick, we cannot bend it. So this is a two point, okay? Very thick thread. But it's not that difficult, okay? Just, put until the end and take out this cap and just push it until the end. While you are pushing it, just take out the cannula slowly. Yeah, finish, okay? Double mold. Okay, this is a double mold. Outside also there is a mold. Inside cannula there is also mold. It's very strong one. So go in, just go slowly. Actually this technique is same. You see the filler area, there is a resistance. Okay, cannot, you see? So that's why, it cannot. I think this filler may be Alansa, it's not a hyaluronic acid, so I don't go more, okay? So in my experience, those who had a filler always headache, be careful. So you should take note exactly which area is the filler, then that area be careful, okay? Okay, so give me a little here.
더블 몰드래.
아니 먼저 줘.
더블 몰드.
Okay. So again, bevel down, and then you see, this is the W type cannula, the blunt cannula. So it's a little bit resistant, but go in. You see here, you pass 1 centimeter, and then hold tight, and shake a little bit, take out. Okay, so you can see two thread here. Okay, some Korean doctor, they pull a little bit more and they tie this one, but I don't like tying, so I don't do it. But many surgical doctors, they like tying, so they tie, but it's your style. 이 타입 2개 더 줘. So bevel down, just go in slowly. You reach the goal. You know, A type is so smooth. You will love this one. Okay. So hold it, and then while you are pushing it, then you leave it. Okay. So bevel down again. So you have to remember, you have to make the planes stretch. Okay. This is a very important technique of Ultra V, stretching technique. Okay. So after that, you push until the end. While you are pushing it, you take it out. Very easy. You finish in 5 minutes. Okay. That's why we name it easy cannula. Okay. And then don't pull too much. You see, because of this filler area, you might have some, irregularities. So don't pull too much. Just pull gently. So many surgical doctors, they like to have the the tying or anchoring, but in my opinion, that's not a good one especially for dermatology or GP aesthetic doctors. Don't do those techniques. I don't do that, but I still have a very good result for many years. So you see these dimplings here? You have to release the dimpling immediately. So the rest of the half, you hold it tight. Okay, you hold tight, don't let them move. And then you wipe this one toward you to release the dimpling immediately. So you remember, I lectured, good lifting is immediately after should have a good lifting also, but there should not be irregularities and there should not be dimpling. Okay, if there is a lot of dimpling, that's not a good lifting. Give me one more cotton. Her skin is so dry, that's why cannot wipe out the green.